Most heart attack does not start in the heart. They start long before, maybe other part of your body, especially in other blood vessels. After age of 50, many people have normal cholesterol, normal blood pressure, and the normal blood sugar, and yet they still have the heart attack. There is one blood marker most people never heard of, and doctors often ignore it until it becomes a problem. It slowly damages the inner lining of your arteries, it increases the clot risk, and makes plaque unstable. That marker is called homocysteine, and stay with me in today's video. In today's video I'm going to explain you best vitamin that protects our blood clots formation and protects our blood vessels against homocysteine levels that are much higher than it needs to be in our blood vessels. And the real problem, what homocysteine does to your arteries. Homocysteine is a natural byproduct of protein metabolism, and your body produces it every day. In a health system, homocysteine is quickly neutralized. It is recycled and removed. But after 50, this process often slows down, and when homocysteine stays elevated, it becomes toxic to the blood vessels. It irritates the inner arteries wall. It increases oxidative stress. It makes surface on the artery rough instead smooth. And when blood clots flow over the rough surface, clot risk increases. And high homocysteine is strongly linked with heart attacks, strokes, blood clots, sudden cardiovascular events, even when cholesterol looks fine. And it is one of the most important markers that you really need to see in your blood, these homocysteine levels. If you won't find out if you have normal or higher homocysteine levels in your blood, you will need to check with your doctor. What is the most important nutrient to prevent homocysteine levels to the high roof? It's going to be B vitamins. Now here's the critical point. Homocysteine is not lowered by statins, it is not lowered by aspirin, it is not lowered by blood pressure medication. And homocysteine is controlled mainly by B vitamins, and the three most important ones are vitamin B6, vitamin B9, and vitamin B12. Those vitamins act like a recycling system, and they help convert homocysteine into harmless compound your body can use. When those vitamins are low, homocysteine builds up silently, and in most cases when you have homocysteine on the higher level right now in your body, it is not maybe a couple of months or maybe in the year. Usually it builds up slowly through many years, someone maybe 5-10 years, and the other end of those problems is going to be heart attack, stroke, or whatever. How B vitamins protects the heart? Vitamin B6 supports the enzymes that move homocysteine away from harmful pathways. Vitamin B9 helps remethylate homocysteine into methionine, and vitamin B12 is required to complete this process safely. Without all three, the system falls. And this is why taking just one B vitamin often does not anything. They must work together. Lowering homocysteine does not unclog arteries overnight, but it reduces constant irritation that leads to clot formation, the plaque rupture. This is prevention. This is not emergency treatment. As I said 1,000 times before, healthy way of living is the constant foundations for the whole your life. And this is the only way how you can protect yourself. There is no quick fix removing blood clots like this, removing risk of heart attack, homocysteine levels in the 1 hour, maybe 24 hours, whatever. There is no quick fix, but there is a right pathway directly in front of you, and this is going to be always healthy way of living, natural remedies, healthy daily habits. Now let's talk about what exactly doses of this vitamin B you really need. For cardiovascular support after 50, commonly used supportive doses are vitamin B6, 10 to 25 milligrams daily. Folate vitamin B9, 400 to 800 milligrams daily, preferably with methylfolate. not synthetic folic acid. And vitamin B12, 500 to 1,000 micrograms daily, preferably methylcobalamin or hydroxycobalamin. Always take B vitamins with the food, preferably earlier in the day. More is not better, the balance is. Vitamin B6 works perfectly together. For you, first thing you need to remember is going to be good quality 100% organic supplements that contain all those B vitamins in recommended daily dose. Really is going to help you a lot. But of course, I'm not going to leave you with just that. I'm going to give you perfect food that really can help you prevent against the heart attack, because they contains a large quantity of vitamin B's inside their compounds. Here's 20 food rich in vitamin B that supports homocysteine control. You really need to eat beef liver, chicken liver, eggs, salmon, sardines, tuna, grass-fed beef, turkey, chicken, spinach, kale, broccoli, asparagus, lentils, chickpeas, black beans, sunflower seeds, pumpkin seeds, avocado, oats, and regular intake matters more than perfection. I'm going to give you a couple of information what we see daily in our office for almost 30 years, when people usually only rely on chemical medications preventing blood clots or homocysteine levels, and this is also very important. Usually this is happening after 12 months of using only chemical medication and totally avoided healthy way of living. When a person focuses only on medication but ignores homocysteine, usually after 12 months later, cholesterol may look controlled, blood pressure may be acceptable, but vessels irritation continues silently, and plaques become more unstable. Blood becomes more reactive, and clot risk rises under stress, dehydration, or illness. Many heart attacks happen suddenly, not because arteries were completely blocked, but because an unstable plaque ruptured and formed a clot. This is the danger of ignoring homocysteine. And while medication alone cannot fix this, heart medication saves lives, and these are essential in emergency, but they do not recycle homocysteine. They do not repair endothelial irritation caused by vitamin deficiency. And this is no failure of the medicine, it is limitation of the model. One treats events, the other prevents terrain damage. If you don't realize this, in the short, this means if you rely only on chemical medications, we see all around the world right now, people are getting heart attacks, strokes, and other problems like never before. Because people don't realize it, what is exactly healthy way of living, what exactly is healthy daily habits, and what natural remedies that really can help them. At the end of the video, I'm going to give you a couple more very important information, especially about using vitamin B if you're already using chemical medications for similar kind of problems. If you are on blood thinners or heart medications, B vitamins are usually safe, but doses should be appropriate. Never self-treat a heart condition, and never ignore warning signs like chest pressure, shortness of breath, or sudden weakness. This is preventative education, not emergency care. Homocysteine is one hidden risk, but it's not the only one. There is another nutrient that really strongly influences the clot formation, and this is well described in many of my videos. But two more informations at the end of the video, my dear viewers. I really urge you to call my office if you're watching me for any country in the world right now, because we're working with the whole world, all continents, and we're making special natural remedies, nutritional programs for our patients. You can call us if you want to find out how you can be healthy again, especially with your heart problems, and if you want even better prevent all those heart problems, heart attack in the safe and natural way. Call us. This is especially important for everyone who have chronic diseases, and you never get better with your medication or whatever you use daily. Call us any part of the world, we will be gladly help you. And second important part is going to be how to use B vitamins in 100% organic form. We also can help you because we know what are the best minerals and vitamins in pure organic form that we use in our office, and we really can help you, give you those information. If you are interested what specific supplements you really can use in prevention homocysteine level, blood clots and heart attack and stroke, call us, send us a message on the Viber or WhatsApp. We will be gladly to help you with those information. Thank you for following, my dear viewers. God bless you. God bless your family. See you next time. My name is Mario. I am European medical professional with over 26 years clinical experience working with the patient all around the world. My core expertise include nutrition, natural medicine, physical therapy and rehabilitation. Through my MarioLab natural healing programs, I have helped thousands of people every year improve their health, regain mobility, reduce chronic pain and chronic diseases, and restore their quality of life. And those programs may help you as well. If you would like to visit my clinic in person, or if you prefer my personal phone consultations without traveling, my team and I are here to help you. Contact us via Viber or the WhatsApp at the phone number +385 98 9179 200. Your health deserves serious, professional, and individual approach. Thank you for following me. See you next time.